Yeah, so my other subspecialty is integrative medicine. I did a 2-year fellowship with Dr. Andrew Wild, the University of Arizona. It's their family medicine department, but it's called the program in integrative medicine. I also did 2 years of Ayurvedic medicine and a year of acupuncture. So I'm really familiar with supplements, their use, their hazards, their effectiveness, or their non-effectiveness. I think wherever possible here, we try and use what is the best evidence-based use of supplements. And you know, we don't use too many different ones. We probably use the ones that are like the highest yield, most effective, which we find to be number 1, fish oil, omega-3 fatty acids. Your brain is mostly made of fat, and of that myelin eicosapentaenoic acid, which is basically what most of fish oil is, makes up a lot of the myelin sheath of your brain. And that's really important because that's where the brakes in your brain are, and that's where the communication in your brain is. And there have been numerous studies, including a meta-analysis for the treatment of depression, that support the use of fish oil. That fish oil helped augment the treatment of depression. It helped people who were depressed become less depressed by adding a fish oil supplementation. It reduces inflammation in the body, reduces inflammation in the brain, improves impulse control in people who have ADHD. There was just a major meta-analysis done that showed that there were, of all the supplements people were giving for ADHD, fish oil seemed to have the most effect in terms of improving their attention, concentration, and their impulse control. The same is true for bipolar, that people who were given fish oil, you know, in some studies they just used fish oil, but you have to take a lot. For that you have to take like 6 to 9 grams of fish oil. Most people can't tolerate that. So normally we may give someone a mood stabilizer and we'll give them like 3 grams of fish oil, because even as an add-on you do get some benefit in terms of helping to stabilize somebody's mood and their impulse control. When it comes to borderline personality disorder, people also found that just giving fish oil improved the behavioral outbursts and the mood lability associated with that disorder. And there's not a lot of medications that help that disorder. And again, if you weigh it out in the risk-benefit relationship, what's the risk of taking fish oil, something that's highly anti-inflammatory and just food for your brain, and what's the risk of leaving somebody more impulsive and more unstable in their mood and their affect? So that's why we use fish oil. We also use folic acid a lot, and that's because folic acid is one of the vitamins that helps your brain to make serotonin, norepinephrine, and dopamine. And obviously here, when you have people who have mood disorders and anxiety disorders, adding folic acid or a B vitamin or a nutraceutical called Deplin can be incredibly helpful to, again, just booster your brain so that it can function better. The third supplement that we use very often, that everyone's always talking about, is the N-acetylcysteine. N-acetylcysteine is an amino acid, and that amino acid helps to regulate one of the receptors in your brain called glutamate. And glutamate is an area of your brain where you have obsession and compulsive types of thinking and disorders. So what they found is that people who use substances, whether it was marijuana, cocaine, alcohol, they had upregulation in their glutamate. And again, glutamate is an excitatory neurotransmitter that basically tells you to keep engaging in the behavior again and again and again and again. And so once again, that makes it really hard for the person to hold back and redirect their behavior away from it, because you are actually having a neuronal signal, an upregulation of a signal that keeps telling you to do it. So multiple studies have shown, and these started with all the animal studies, especially for cocaine, that using N-acetylcysteine normalized glutamate. They actually looked at the brains, and they looked at the part of the brain where glutamate was, and they saw in these rats that actually their glutamate receptor went back to normal when they were taking N-acetylcysteine. And then in trials for cocaine, it was shown that more people stayed in their psychosocial treatment if they were taking N-acetylcysteine versus if they weren't. It was also shown in one heroin study that people who were taking N-acetylcysteine were more able to stay sober. And it's one of the only things that's ever been shown to help people addicted to marijuana stay inside. Now again, none of this makes up for psychosocial treatment. These are just things we add on to psychosocial treatment. And everything that was added on for marijuana, and I could give you a list this long of things they've tried, never worked. But what did work was N-acetylcysteine. And again, if we stand back and we go, what's the risk benefit of giving someone an amino acid, that's shown to be a super antioxidant for your brain? Even if it doesn't work, there's really no harm in taking a super antioxidant. So that would probably be the top three supplements we use here.